Physical therapists have many roles and can provide a wide variety of interventions. We would like to highlight a few. First, physical therapists are movement specialists, and so they are essential members of the healthcare team for patients who cannot move safely and independently. Second, physical therapists are exercise specialists. From patients with orthopedic impairments to neurological conditions, physical therapists have the knowledge and skill to help them regain strength and function. As described by the American Physical Therapy Association, physical therapists help individuals maintain, restore, and improve movement, activity, and functioning in order to ultimately improve people's quality of life. In order to become a physical therapist, an individual must complete an undergraduate degree and then complete an accredited Doctor of Physical Therapy program. These programs typically last 2.5 to 3 years. Thus, similar to pharmacists and physicians, the only entry-level degree is a clinical doctorate. Physical therapists receive education and training that prepares them to work in a wide range of healthcare and non-healthcare settings, as seen on this slide. While people tend to associate physical therapists with sports and orthopedics, most people are surprised to learn that physical therapists are trained in wound care, including conservative sharp debridement. Physical therapists are increasingly working in emergency departments as well. Upon graduation from an accredited Doctor of Physical Therapy program, many physical therapists pursue residency and fellowship training to develop a specialty and then a subspecialty. Physical therapists can also earn advanced clinical specializations. They would typically add the initials seen in the parentheses on this slide after the letters PT at the end of their last name. This then indicates which specializations that they have earned and thus what areas of physical therapy they have a particular expertise in. Like other healthcare providers, physical therapists are licensed to practice by each state, and their scope of practice can vary somewhat depending on which state that they are licensed in. Notably, almost all states allow patients to have full access to physical therapy evaluation and treatment without requiring a referral from another provider, such as a physician or dentist. Texas is one of the very few exceptions. A physical therapist may evaluate a patient without a referral, but a referral would then be required to implement treatment, thereby likely creating a delay. We hope that this changes sooner rather than later so that Texas citizens have the same opportunity to access a physical therapist's expertise as most citizens in the rest of the country do. The figure on the right of this slide depicts the physical therapist patient-client management model. Physical therapists complete a thorough patient examination and evaluation, identify or confirm a physical therapy-related diagnosis, determine the prognosis, and implement appropriate interventions, often ones related to movement dysfunction. While physical therapists are solely responsible for completing the physical therapy evaluation, they may then delegate some types of interventions to physical therapist assistants. Physical therapist assistants are also licensed healthcare providers and can only work under the supervision of a physical therapist. Physical therapists are likely most known by the public for addressing musculoskeletal pain. However, many people are unaware that physical therapists are trained to complete a systems review and red flag identification in order to identify if pain appears to be from a non-musculoskeletal source and therefore would require a referral to another provider. An example might include signs and symptoms of a spinal cancer or infection as a source of lumbar pain, presence of cauda equina syndrome or abdominal aortic aneurysm that necessitates emergent medical referral. Another example of a non-musculoskeletal source of shoulder pain could be cardiac or visceral referral, or perhaps constant muscle pain that might be related to a statin prescription. As seen in the example, physical therapists are also trained to look at the big picture, not just look at where the pain is, but most importantly to evaluate and treat where the pain might be originating from, for example, the spine. Physical therapists even have a role in combating our nationwide opioid crisis. The U.S. Centers for Disease Control recommend physical therapy as a safe alternative to opioid prescription. Many other examples exist. If you wish to learn more, the students and faculty at the Doctor of Physical Therapy program at the University of Texas at El Paso will be happy to provide further education about our profession.